Hello, and welcome. My name is Dr. Calliope, and I'm going to be performing your examination today. How are you doing today? Okay. Well, I hope that we can make you feel even just the smallest bit better by the time you walk out of the office today. Okay? Would you mind just confirming your name and date of birth for me? Let's see. There we are. Okay, so it looks like today we have you booked in for a cardiovascular examination. Is there any particular reason why you wanted that examination? Okay. All right. So I'm just going to be asking you a few questions before we begin with the examination. I'll go over what we're going to be doing, okay? Do you have any current pain or discomfort at this moment? Okay, excellent. And any changes to your medical history since we last saw you? Good. What about your family history? Anything new there? Great to hear. And what about your allergies? Everything all still the same? Okay. And your medication list, is that up to date? Taking anything new? Stopping anything? Okay, excellent. All right. So I'm just going to pop on a pair of gloves real quick, okay? So for our cardiovascular examination, I'm going to be looking at you as a whole. I'm going to be looking at your hands, your face, your chest, of course, your back, a little bit on your neck. So for this examination, I will need to touch you. Do I have your consent to do that? Is that okay? Okay, excellent. So firstly, I'm just going to take a broad look at you, okay? I'm going to step back, and I'm just going to look at you as a whole, noting any issues with cyanosis or pallor issues, seeing if I can see any scars or anything that would lead me to believe you're having some issues in the cardiovascular variety. Okay? Alright. All looks good. So it looks like we still need to grab your vital signs. Okay, they didn't do that when they brought you in. That's okay. So let's go ahead and start by taking your temperature. Got a little thermometer here. It's been thoroughly sterilized. Okay, I'm just going to turn this on. I'll have you just open your mouth for me. Okay, and put this under your tongue. You can lay your tongue back down. We'll wait here for just a few seconds. And that should be good. Okay, excellent. Very pleased with that. So for the purpose of your vital signs, I'm going to be taking your pulse and respiratory rate. I will probably take your pulse again during the examination, but I want to make sure we're checking all of our boxes. So I'm just going to check here on this hand if that's okay. Okay, so I'm just going to put my fingers right below the base of your thumb, your radial artery. Okay, we're going to wait here for a little bit while I count the beats and assess your respiratory rate, okay? Okay. that's all within normal limits. Excellent. So I'm going to be assessing your blood pressure real quick. Now, generally one would do this on just one side. However, for the purposes of this exam, we'll be checking on both sides. So I check blood pressure maybe a little differently, although it's becoming a lot more popular now. So I'm going to put my cuff of my sphygmomanometer on you, and then I am going to have you lift up your arm and just rest it along mine. I'll put my thumb into the crook of your elbow, and that's how I'll be able to feel when the blood stops flowing and then when it starts back up, okay? Is that quite firm? Very good. So I'm just going to run the two tubes along your arm. Okay, if you want to go ahead and put your arm up on mine. Alright, just relax your arm. Let me take the weight of it. Okay, I'm going to go ahead and assess your blood pressure. Okay, I'm going to do that once more. Excellent. So I'm going to go ahead and assess that on your other side. Okay. Again, just putting your arm just relaxed, and I'll put this down. Okay, it's quite firm. So again, I'll just have you rest your arm along mine while I just press my thumb into the crook of your elbow and just start inflating the cuff. Try that again. Excellent. All right. And take that off your arm. All right. It's about the same on both sides. That's good. Excellent. So next, I'm going to grab your oxygen levels real quick. I have a little clip right here that I'm just going to slip onto your finger, okay? There. Right. We'll leave that on for just a little bit. Okay, very good. Looks good. They did grab your height and weight before they brought you in. That's excellent. Okay. So we're going to start in on the exam. I'm going to first inspect your hands and your fingers and your nails, okay? So if you could just hold out your hands for me in front of me, I can just take a little look. Okay, and can you flip them over? Okay, you mind flipping them back over, and I just want to take a look at the nails. to check the capillary refill time, so I'm just going to be pressing firmly on your fingernail for about 5 seconds and then release. Okay, very good. Let's do that again. About 5 seconds and then release. Good. I'm going to do that on your other hand. Pressing down on your nail for 5 seconds and then release. Good. And pressing down on the nail and then releasing. Excellent. So if you wouldn't mind, it's going to be a little hard to show you with gloves, but if you could just press your fingers together like this, okay? You can even go like that, I suppose, but I want your first joints, your first finger to be together, okay? Alright, very good. Just checking for any clubbing. That's good. And go ahead and put your hands down. Now I'm going to be checking the temperature of your arms and your hands, okay? So I'm just going to use the back of my hands and just press them down on your arms. Just checking the temperature. Okay. That's all nice and warm. Very good. Okay. I'm going to write that down real quick. Didn't have any issues with coloring or nodes or lesions. Okay, and then I'm going to be checking your pulses. First, I'm going to check for a radial delay. I'm going to take both of your pulses at the same time on your radial arteries and see if there's any delay in the pulses. I've got your one wrist here, the other wrist here, and I'm just going to make sure those match up. Okay, very good. Now I'm going to be checking for a collapsing pulse, so I'm going to put one of my hands on your radial pulse, one on your brachial pulse, which is in the crook of your elbow, okay? And then I'm going to be lifting your arm pretty quickly above your head. Do you have any pain in your shoulder at all? Okay, alright, so I'm just going to grab your wrist, grab your arm. Just feel that. Okay, we're going to lift. Okay, and come back down. Okay, excellent. Write that down real quick, and then we will take your brachial pulse. So I'm going to use the other arm here since we just checked for a collapsing pulse. And I'm going to be pressing quite firmly. Let me know if it's painful at all. Okay, right in the crook of your elbow. Very good. Okay, that feels good. Alright, so now I'm going to be auscultating, which is a fancy medical word for taking a little listen to your carotid arteries to listen for any bruits. So if you could just turn your head slightly to one side or the other for me. Okay, I'm going to pop in my stethoscope. Alright. If you wouldn't mind just taking a deep breath in, deep breath out, and holding that. Good, okay, take a breath. I'm going to do that again for the other side. If you could just turn your head for me. Okay, take a deep breath in and out and hold. Okay, very good. You can go ahead and breathe normally. So there weren't any bruits, which means that it is safe to palpate your carotid artery. If you wouldn't mind, this might be a touch uncomfortable. I do apologize. But I'm just going to be palpating your carotid artery on one side. Good. And then the other. Okay, very good. So now I want to check your jugular venous pressure. So if you wouldn't mind just lying back a bit for me, okay? And if you could turn your head to the left, right? I'm just going to be looking at the side of your throat. Everything's looking normal there. Alright, so I want to check your hepatojugular reflux, if there is any. And to do that, I need to press quite firmly on your liver. Do you have any pain in your abdomen at all? Okay, so I apologize. This might be a touch uncomfortable. I want you to hold that position, and I'm just going to press into your liver, okay? Alright, very good. You can go ahead and put your head back. Very good. Negative on the reflux. Excellent. So I want to take a little look-see at your face, your eyes, your mouth, okay? So I'm just going to be coming in a little closer to just take a little peek at your eyes, around your eyes. Okay, looking at the color, any abnormalities. Now, I'm going to check your conjunctiva, so I want you to look upwards, and I'm going to pull down on your eyelids, okay? Look down, look up. Okay, very good. You can go ahead and look normally there, okay? Would you mind opening your mouth for me? Okay, real wide. Excellent. And can you put the tip of your tongue to the roof of your mouth? Okay, very good. That's excellent. You can go ahead and close your mouth. That all looked normal. And so we're going to move on to taking a look at your chest, okay? The anterior chest wall. Okay, so I'm going to be taking just a little bit of a detailed inspection of your chest, noting any deformities or scarring. Okay. Would you mind lifting one arm up for me so I can check the side? Good. And how about the other side for me? Very good. Very good. Okay. So I'm going to be palpating the apex beat, which is along your fifth intercostal space and your mid-clavicular line. Okay. I'm just going to be coming across here, mid-clavicular line, fifth intercostal space, and just pressing my hand there to feel for the apex beat. Okay, very good. So now I'm going to be assessing for heaves and thrills, okay? I'll do this with my hands. I'm just going to be first putting my hand, heel of my hand almost around your sternum area, okay, right about here. I'm just going to feel here for any heaves And now I'm going to be feeling along each of your heart valves for any thrills, which are palpable heart murmurs. Okay? Okay, so first I'm going to feel here on the mitral valve. Okay, and the tricuspid valve. Pulmonary. Very good. And aortic. Okay. Alright, that all feels just fine. So after I write this down real quick, we'll go ahead and auscultate those valves. I just want you to breathe normally for me, okay? So first I'm going to take a listen here to the mitral valve. Okay. And the tricuspid. Good. And the pulmonary. And the aortic. Very good. Okay. So I'm going to take a listen to your carotid, okay? And I want you to take a deep breath in and hold it for me, okay? Very good. Okay, you can release that. And then take a deep breath in. Hold. Okay, and release. Very good. So we're going to be doing some accentuation maneuvers, which is essentially that I'm going to be making you do some different exercises, maneuvers really, to see if it accentuates any irregularities, okay? So firstly, I'm going to put my stethoscope back on, and I'm going to have you sit normally first, and I'm going to take a listen to the aortic area here, okay? And I want you to go ahead and sit forward for me, okay? Just bring yourself forward. Okay, very good. You can go ahead and sit normally. Alright. Okay, so now we are going to be doing some accentuation maneuvers, which means that I am going to be having you perform some very simple actions that would accentuate any irregularities in your heartbeat, in any of the sounds, the valves. Okay, so I'm just going to put my stethoscope back in, and then I'm going to take a listen to the area around the aortic valve. Okay? I want you to take a deep breath in and out and hold. And then if you could sit forward for me, just lean forward. Okay, very good. You can go ahead and sit back, right? So now I'm going to have you adjust so that you're laying down, and we're going to roll you onto your left side, okay? Okay, I'm going to put my stethoscope over on the mitral area, and I want you to take a deep breath in and out. Okay, hold that, and then we'll roll you onto your side, okay? Very good. You can go ahead and roll back. Alright, so now I'm going to be taking a look at the posterior chest wall, which is your back. I'm going to be just inspecting it, and then I'm going to be percussing it, taking a little listen. Okay, so I won't be in view for a little bit of time, alright, but I'll let you know what I'm doing. Okay, so I'm going to come around to the side of you. Okay, so I'm just having a look at your back, see for any scarring, any deformities, anything of that sort. Okay, I'm going to go ahead and put on my stethoscope and take a little listen. I want you to take a deep breath in and out. 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 And lastly, deep breath in and out. Very good. No crackling in the lungs. Okay, so I'm going to go ahead and percuss your lungs. So I'm just going to be placing my hand on your back and then tapping on my finger that's on your back. Okay, and I'm just listening to the sounds that come back from that. Okay, good, 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 good. Very good. Very good. Excellent. So, I'm just going to be feeling around your sacrum for any sacral edema, okay? Just putting my hand on the small of your back here. And just taking a little feel. Alright, very good. I'm going to come back around. Okay, we are very nearly done. So I just want to have a look at your legs, and I'm going to check your ankles for pitting pedal edema, okay? Alright, so I'm just going to be sinking down for a minute. Just having a little look at your legs, looking for any scarring primarily. Okay, take a look at your feet. Good. And I'm just going to be holding around your ankles. I'm just going to be feeling for any edema and looking to see if you have any pitting edema. Okay, no, that all looks good. Right, I'm coming back up. There we are. So that concludes our examination. You have any questions for me? Any concerns? Okay, let me just take a moment to finish writing all of my notes. There we go. So I'm very pleased with how everything turned out. I think you are in excellent cardiovascular health. just go ahead and sign off real quick. Very good. All right. I think that's all I need from you. Thank you so much for coming in the clinic today for this cardiovascular examination. I hope you have a whale of a day, and I hope you have a good rest of your night. Thank you.